Hello, welcome to the Destin Business Forum, brought to you by the Destin Area Chamber of Commerce. I'm your host, Amy Perry, and our guest today is Dr. Shawna Hogan with the Regatta Chiropractic and Laser Center.
Correct. Good morning.
How are you?
I'm well. How are you today?
Good, thanks. I think your office is right next to my office. I've been
is.
curious about what's going on, so I'm glad I get to interview you today.
Thanks for having me.
Tell me about your place. What is Let's back up a little bit.
Okay.
Starting out and backing up. Tell me what chiropractic or chiropractic care is generally, and then I'll get to your place specifically.
Sure. Chiropractic care focuses on restoring the normal motion of the spine. Most people, when they think of the spine, envision a very rigid structure.
Mm-hmm.
The spine, if we look at you from the side, actually has 3 curves to it and 24 movable segments. So the spine is very dynamic. As we move through the day, through our lifetime, the spine moves with us. So chiropractors focus on restoring that normal motion if any of it has been lost.
So does it, as a general statement, does it tend to get out of alignment throughout the day?
Correct. Because the spinal segments move and all of the different activities that we do throughout the course of a lifetime, some of the segments can start to lose their normal motion. If the body doesn't correct that on its own, eventually we get irritation to the nerves at that level, irritation to the muscle, and then eventually, but not right away, we get pain. Pain is really just our body's way of letting us know something's not right so that we can do something about it.
You can fix it.
So chiropractors work on restoring that motion to alleviate a lot of the musculoskeletal issues that we suffer with.
So I would assume if it's done right, when you leave your office, you feel better because everything is
Correct.
working as it should.
Correct. We're alleviating the stress and tension on the spine and the nervous system, and then eventually that symptom does abate.
Okay. All right, tell me about your place specifically. What do you
Sure.
do? I know there are 2 different things, the Laser Center and the chiropractic. Let's start with the chiropractic first.
Correct. We are first and foremost a chiropractic health center. We focus, we're very much patient focused. So I often hear patients say that they feel like they're being milled in and out of doctors' offices nowadays. So we try to be patient focused in that we want everyone to feel like their voice is being heard, their needs are being met, they're not waiting for a long time. So we are first and foremost a chiropractic office. We also offer therapeutic massage therapy as well as relaxation massage therapy because we feel...
Tell me the difference between therapeutic massage therapy and relaxation.
Well, it really is goal dependent. If a patient is suffering from a musculoskeletal issue, our therapist and I can work together to look at creating more of a balance in that person's spine. This comes into play for athletes. They're looking to build muscle, build their physique. We want them to do that on a balanced foundation.
Gotcha.
Versus someone that's just looking on a Friday afternoon to relax and ease into the weekend.
Gotcha. Okay. On the Laser Center side, what is that exactly?
We feel that feeling your best and looking your best often go hand in hand. So a few years ago, I brought a laser called Zerona to my Pensacola practice when I had an office there. Zerona is an FDA-approved painless cold laser for body slimming. You may have seen it on the Dr. Oz show. It's been featured in the Wall Street Journal, etc. And it helps people to lose inches of fat fairly quickly, painlessly, without any reported ill side effects.
Wow. And how many, I assume you have to have more than one treatment?
Correct. You have to come in every other day for at least 2 weeks, so it's always done as a minimum series of 6. In our office, you can start with 6 or 12. We began doing it a few years back as a way to get our patients with low back pain excited to start losing the belly.
Because I would imagine if you lose weight, if you're a little bit overweight and you lose weight, that takes the stress off of
the spine, absolutely.
Gotcha. Okay. And how long do each of the sessions last?
They're 40 minutes, 20 minutes of which you lay on your back, 20 minutes on your tummy, and the loss of fat is actually throughout the body, which is one of the ways that Zerona is unique. You're not having to pick and choose and pay per body part.
Where you want to?
And everyone has inches that they want to lose, depending on, you may be a bigger person or a smaller. We all have some inches somewhere that we'd like to see maybe changing.
Absolutely. I'm going to back up a little bit
Sure.
again and tell me, what does it take to become a chiropractor? I'm sure you have to have some advanced training.
Correct. The chiropractic program itself is about 4 years, 3.5 to 4 years, and then prior to starting, you need what is the equivalent of a bachelor's degree. So I have a Bachelor of Science.
Okay.
Following the 8 years of schooling, there's a series of national boards, of which there are 4 parts. And then for the state of Florida, when I graduated, there was also a separate state board. So you spend quite a lot of time studying and continuing education yearly.
Sure. What got you interested in chiropractic? I'm always, want to know why people get into the business.
People ask me that all the time. My mother actually was a manager of a chiropractic office when I was growing up. So My brother and I spent countless hours at the chiropractor's office with my mom, and I've always been curious about it. In fact, I did a science fair project on chiropractic in the 4th grade, and my mom and I used to joke that someday she would run my office, and fast forward, she's now been my office manager for 8 years.
Really?
Yeah.
Oh, that's neat. Okay, sort of a personal question. I've been to a chiropractor before, was a little bit nervous,
Sure.
turned out great, but they, I don't know what it's called, but they will take your
Manipulated your knee.
head and like kind of pop
Correct, yeah.
It didn't hurt, but it just the sound, and I was
Sure.
very nervous about it.
Sure.
Is that something that all chiropractors do, or can you not do that?
You can. As I mentioned before, all of our services are catered to a patient's particular needs, concerns, and I think that speaks to the fact of me being female as well.
Mm-hmm.
Women tend to listen and be more aware of
Right.
someone's apprehensions coming in. The word chiropractic means by hand, so a lot of our work is performed by the use of our hands. That noise that you heard is spinal fluid or motion as we change the pressure within the spinal joints and restoring the normalcy to the spine. So if you understand that going in, I think you are less concerned.
Right, it's not your bones.
It's not
cracking or-
right. Nothing's breaking. In addition, for patients who are not comfortable with that, even if they have a proper understanding, or for small children, for people with osteoporosis, we also use a technique called the activator, which is a handheld instrument, the rubber tip of which is applied to the segment that needs to have motion restored, and with a quick impulse, we're able to restore motion there. So you don't hear any of that audible sound that people find scary. So we take that into consideration in determining a treatment plan for someone.
Okay, you mentioned children. What's your clientele? Is it kids, adults, both?
It really is a little of everyone. I have a special interest in my practice in the care of pregnant women as well as children, and I've done some additional studying for that. That's not something that all chiropractors are interested in. People oftentimes don't understand why kids may need chiropractic care,
Right.
And they may not all, but we often see children who suffer from issues such as ear infections and colic. During the birth process, the muscles of the neck in particular can tighten up, and without getting into too much detail, that stops the body's lymphatic system, the housekeeper, from being able to, properly clear those ears. With a little gentle finger pressure type adjustment in the neck, oftentimes that is able to help restore the body's own natural healing capacity. And those are the little ones who maybe don't have to have those ear tubes put in or
Sure.
continue to live on antibiotics.
So to sort of summarize what you just said, you help the body help itself.
Exactly. We restore the normal healing capacity that is within all of us by reducing any sort of interference to the nervous system. And you asked before also who the rest of our clientele is. We see everyone from people injured in car accidents to pregnant moms to small children to anyone suffering from any sort of musculoskeletal issue.
Or someone that just needs that Friday afternoon
Right.
relaxation
Feel good.
massage.
Exactly.
We're almost out of time. Tell me where you are located.
My office is located in the heart of Destin, just east of Destin Commons, and our door actually faces the Destin Chamber of Commerce. We're at the entrance to Regatta Bay.
Okay. And if someone would like to make an appointment or find out more, they can call your mom.
They can.
All right, tell me your number. I'm sure they'll put it up on screen, but
850-424-7856, or you can visit us on the web at regattachiropractic.com.
great. Thank you, Dr. Hogan.
Thanks for having me.
We'll be back.